Okay, we're back. We're going to connect our machine now that our circuit's connected to our 50 psi quick connect. If you'll do the honors. Okay, I've also connected my end to a test lung to allow me to operate the machine. Here, I'm going to power it on. Now, at any time, I can power on the machine by hitting the clip here. Now, usually what I'll do when I'm testing to see what I want the patient to get is I'll go ahead and turn the thing on, put my finger slowly over the outlet, and it should cycle off. If I have everything connected, it should cycle off. When I put my finger slowly over the outlet, it should cycle off, and at the moment it cycles off, that pressure reading on this gauge is your set inspiratory pressure. Let me put my test lung back, cycle it on, and let's see what we're reading. I'll turn it around real slow. So right now it looks like, will you mind doing the honors? Go ahead and cycle it on. Let's see what our gauge reads. Now I don't know if the viewers can see this, but our gauge is reading about 15 centimeters of water. Here, we'll come in real tight. Okay, try it again. We're cycling off at about 15 centimeters of water pressure. Okay? Go ahead. Okay, now, that's a good starting point for IPPB, between 15 and 20 generally. Let's go up to 20. I'm going to push this knob on the right here. Go ahead and cycle me on. One more time. Again. Again. And I'm slowly inching up my knob by turning it clockwise again and watching the gauge until I reach 20. Again. Alright, there we are. Now we're cycling off at 20. Now, how hard the patient has to suck to get the machine to come on, that's your sensitivity. And let's see if I can imitate that by grabbing this bag. And if I can make the needle move backwards a little bit, I think I can simulate the sensitivity. And I successfully did so. Now let's make it less sensitive. And I'll do that by turning the knob clockwise, makes it less sensitive toward me, and now I'm having difficulty starting the machine on. So how hard should this be? Now you cannot set this knob, this sensitivity, you can't set it till you have a patient on and the patient sucks in. When the patient sucks in, then you can see on this gauge right here how far back the patient has to pull it, and then you'll know if you have your sensitivity set appropriately. In fact, let me do something. I'll come right back. I have a little more light on it now, and I put a mouthpiece on. What I'm going to do is I'm going to suck in, and you'll be able to appreciate how hard I have to suck to get the machine to cycle in the on position. Okay, I didn't really have to do anything. So let me make it less sensitive. At this moment, I think I'm having to pull in about, okay, that's negative, the red area is negative 10, so I'm having to pull about -4, -5 to get it to come on. Which is really too hard. I'd prefer to have it -2, so let me turn this in a is that right, counterclockwise direction? Okay, let's try it now. That seems okay. Now what you don't want is this thing so sensitive that it comes on by itself. Go ahead and pull that out and cycle it off. And see, the minute you pull it out, it cycles right back on, doesn't it? That's because it's too sensitive. It's coming on by itself. Now let's make it stop doing that. There. Now let's try it again. Let me suck in. That felt about right. I didn't have to exert too much effort. So this side sensitivity is set to -2 by this control knob. And it shows you, if you forget which direction to turn it, shows you increasing or decreasing sensitivity on the unit. I would recommend with these machines literally ignoring the numbers that are painted on there and simply go by the gauge. Okay, there's your first, once I've tested, before I start my patient, I've tested the machine by cycling it on, by hitting the red and putting my finger slowly over the outlet to test the pressure that it cuts off at. And I'd like to start between 15 and 20. On this particular machine, millimeters of mercury is on the inner ring and centimeters of mercury is on the outer ring. Traditionally, we go by centimeters of water pressure. Sorry, not centimeters of mercury. We traditionally go by centimeters of water pressure. Okay, let's cycle it on. Let's put our test lung in place. Cycle it on and see where we are. Now, at some point I fiddled with my pressure and I've got it way too high, so let me turn it back. Now, where's that hitting? About 22. Okay. Now, my next step after I have my patient breathing is to fiddle with the or adjust the flow rate. And you can tell, let's turn it way down. Now this is a breath that's going, look how slowly it's rising to the pressure. Now tell me what it rises to. How high does it go? About 22? Okay, now let me turn it way up and you tell me again what level it rises to. What I'm trying to demonstrate is that the peak flow rate and the pressure level are independent of each other. So it's still, this machine, because this is set to cut off at 22, it will cut off at 22 regardless of how fast or slow that I put this peak flow rate on. So what do I set my peak flow rate on then? What's comfortable for the patient? Think about our goals. Our goal is to give the patient a slow, deep breath. And so I sort of breathe with the machine, and I see if I can do that, the patient probably can. So, you think you can do that? You think you can take a breath that long? I don't want the eye time, the amount of time it takes for the breath to be longer than what the patient can do. So, of course, I don't want it too fast. This would obviously be too fast. That might be too fast for the patient. Too fast. And this is then, or down here, might be too slow.
Oh, that is too high time is
Too high time's too long, slow's too slow. So I'm just setting this really to the comfort of the patient. A slow, even, deep breath is what I want. Generally, on ventilation, a typical setting is to allow the patient twice as much time to exhale as they had during inhalation. So that's one strategy for setting it. But when you're giving an IPPB treatment, you might base it strictly on their comfort. So flow to their comfort of what seems right for the proper IE ratio, a starting pressure between 15 and 20, and a sensitivity at -2. So now I'm ready to proceed with my treatment. Patient is breathing on the treatment, and we'll get started with the next step.